Great. Thanks, Gordon. And good morning, good afternoon, good evening, wherever you're joining us from today. I'd like to acknowledge I'm coming to you from the lands of the Wallumattagal clan on the northern shores of the Parramatta River in Sydney. And I'd like to pay my respects to their elders past, present and emerging, and those of the hundreds of First Nations communities around the unceded country we now call Australia for their long-standing care of the lands and seas I have the fortune to live, work and occasionally travel to see. As a clinical trial operations professional that's become an advocate for community partnership in research, as a path to more efficient, relevant, respectful and implementable research, it is really my pleasure today to moderate this session. And I do hope to keep the time out of respect to all the speakers. Each speaker has an allocated time. We're going to try and leave a minute or two at the end of each of their presentations for questions. But just in case we run out of time, if you drop your questions in the Q&A, the presenters can also then respond to them directly, as it's a little harder in the chat. I'd also invite the presenters to share their email in the chat should they be happy for people to contact them outside of the conference. As Gordon mentioned, on Tuesday, there were many abstracts submitted around consumer engagement, but the very small selection that we have today were, I guess, deemed most relevant to the audience of HREC members that are attending this conference for really improving their understanding of what partnership with people with lived experience can look like, how it benefits, and how it really might apply to the work of ethics committees. So with that, I would like to welcome our first presenter from the US. Thank you for joining us in your evening, Adam, to talk about community-based participatory research. Over to you.
Great. Hopefully you can see the slides in presentation form.
At the moment, we've got your notes view, Adam.
Oh, you do still. Let's see. How's that?
We've got your presenter view. So if you want to maybe turn off presenter view and just show the actual presentation.
So David, just go to display settings at the top of your screen there and switch screens.
We'll be able to see. Let's see here. Let's try this one. No.
Now just go to display settings at the top there, Adam.
Show webinar? No.
No, just above your slide. Display setting, show taskbar, then display setting.
Oh, I see what you're talking about.
And then swap presenter view. That's you.
Excellent.
No, now I can't see my notes. Sophie, I guess I should have practiced this, huh?
So one of the things that you can do, if you go back to presenter view, on the bottom, just underneath your slides, there will be a list of things, and one of the things you can do is hide presenter view, and then you should be able to see two screens.
I can't see my notes now the way this is working out. All right, let me go back to this one. Well, okay, I'll read my notes from in front of me. So I want to start by thanking Gordon for inviting me to kick off this panel today, Sophie for ensuring that I did what I needed to do, and my colleague Seema Shah, whom you may have heard speak earlier in the conference, for connecting me to you all. In my talk, I'll focus on community-based participatory research, opportunities and challenges, and the implications for human research ethics and research ethics committees. I've been engaging in and teaching courses in community-engaged research and community-based participatory research for over 30 years and have experienced firsthand and also heard secondhand about how CBPR presents challenges to research ethics committees and vice versa. And I'll be sharing those and also some examples from an emerging literature on these issues. I'll refer to research ethics committees broadly and to institutional review boards or IRBs when it comes to specific examples, because that's what we call them here in the US, and that's where my examples come from. No, I gotta find that. Okay. I'm in Chicago in the US, located on the ancestral homelands of the Council of the Three Fires, the Ojibwa, Ottawa, and Potawatomi tribes, and I have no financial or other conflicts to disclose. To tee up the panel and the discussions that may occur today, I'm going to be covering three themes to frame the issues at the intersection of research ethics and CBPR. I'll start by sharing some key principles of CBPR and IRBs and the potential synergies between CBPR and human subjects protection. I'll then present some of the specific challenges and tensions that arise when CBPR projects are considered by research ethics committees, and I'll close with some of the solutions proposed and actual that can or have helped to create a more seamless relationship between CBPR researchers, community partners, and institutional review boards. And then I believe we'll still have some time, even with my technological mishaps here, for questions at the end. Community-based participatory research and the guidelines, rules, regulations, and legislation that govern human subjects protections really are solutions to related problems. CBPR and other forms of participatory research and research ethics and review committees both emerged in response to a long history of research abuse, resulting in harm to individuals and distrust among communities and their members. These harms certainly have been bodily, but also have been violations of privacy and other human rights. And as you all well know, research ethics committees and institutional review boards are charged with ensuring that institutions conducting research adhere to established rules, regulations, guidelines, and policies that are meant to protect individuals from the potential harms of research. CBPR developed within the field of public health to respond to a history of health-related research that disempowered and otherwise harmed communities and their members, building on traditions from other disciplines that strive to do research with rather than research on communities. In theory, these could be seen as congruent components of an overarching approach to ensure that research does no harm while advancing the public's interest. When we dive a little deeper and examine the principles of CBPR and human research ethics, they certainly feel synergistic. On the left are 8 key principles of community-based participatory research that my colleagues and I first published in 1998. Some examples that I think are especially relevant to the topic at hand today are the first, which states that CBPR recognizes community as a unit of identity and works with existing communities of identity across or within communities of geography. The third principle, that CBPR facilitates collaborative partnerships in all phases of the research. The fourth, which states that CBPR integrates knowledge and action for the mutual benefit of all partners. The sixth, which states that CBPR involves a cyclical and iterative process that's constantly changing in a feedback loop from data to analysis back to intervention, et cetera. And the last principle here, that CBPR disseminates findings and knowledge gained to all partners through means that are equitably accessible and help all partners to achieve the goals of dissemination. CBPR partnerships build structures and establish processes to follow these principles. Human subjects protection, described here on the right, focuses on 3 principles of research non-maleficence, at least in the US context. The first being respect for individuals or persons, the second being beneficence, or the idea that research minimizes harm and maximizes benefit, and the third being justice, or the appropriate distribution of risks and burdens of research across populations. Also in the US, IRBs oversee the application of these principles through a primary focus on informed consent, assessment of risks and benefits, and selection of research subjects. Human subjects protection, this is right in my notes. While these feel like synergistic ideas, and it would seem that the structures and processes we build to oversee their application and implementation should work in concert, CBPR partners and research ethics reviewers have identified a number of ways in which these approaches come into conflict. These challenges have been summarized in a recent article in the Journal of Clinical and Translational Science into 4 main categories. First, community partners may not be recognized by IRBs as equal research partners. In CBPR, community partners both conduct and participate in research. They are researchers and subjects. For example, recent approaches to evaluating CBPR initiatives include analyses of the effects of partnership structure and quality on the success of strategies to change community conditions that lead to poor health outcomes. Academic and community partners in CBPR design the instruments to collect data about the partnership and provide data by taking surveys or participating in interviews and focus groups. IRBs sometimes struggle with these dual roles. Many CBPR projects, because they strive to build skills and capacity in all partners, their institutions and communities, often want to hire community members to administer surveys or facilitate focus groups, or even analyze data, especially qualitative data. Engaging the non-academic partners in this way has been a challenge in my own work to the IRBs that I come before, and is a challenge that is articulated throughout the experience of people who conduct community-based participatory research. Similarly, CBPR researchers and IRBs may have differing views on data ownership that can create challenges when research institutions feel, for example, that protection only happens with academic control, while CBPR strives for shared control. The second broad challenge is around cultural inaccessibility. For example, CBPR focuses on the health and well-being of the community as a whole, as well as the individuals within it. IRBs focus primarily, if not solely, on individuals. In an effort to assess risk and benefit or to define eligibility and exclusion, IRBs may seem to be asking questions or identifying concerns that either miss the point or don't go far enough for CBPR partners. In addition, the idea that the academic institution should be the sole arbiter or have the final say on whether a project is harmful or beneficial to a community that it may not be a part of, or that itself has harmed in the past through, for example, financial decisions, land use, or impact on the environment, can feel disingenuous or even hypocritical, especially to the research partners who are from the community who's experiencing harm. One way in which this challenge of cultural inaccessibility frequently manifests itself is in the consent form and process. CBPR partners are driven by an interest in ensuring that no one feels alienated or is disempowered by research. Consent forms, especially from healthcare institutions in the US, can be lengthy, include very technical language, and often are standardized regardless of the risk level of any particular given project. The density, length, and language of consent forms are therefore often seen as problematic by CBPR researchers, and their interest in revising them can be problematic for the ethics reviewers or the legal staff of an institution. A third challenge is that IRBs sometimes apply approaches to ethics review that can feel formulaic. In the US, in response to what some have called the overregulation of human subjects research, the increasing number of disciplinary actions related to administrative processes rather than to actual violations of research ethics, and the sheer volume of submissions to RECs, institutions have made great strides in standardizing and digitizing submission processes, tools, and materials. These advancements may be critical for quality and efficiency, but they can feel alienating or even antithetical to the idea of participatory research, especially when non-academic research partners don't have access to those processes and platforms. A fourth challenge is related to the other three, and that is that ethics reviews can take time, especially for community-based participatory research, when there is a lack of understanding between researchers and reviewers that results in multiple revisions and resubmissions. CBPR is focused on research and action and is intended to address community conditions that lead to poor health outcomes. The problems are concurrent with the effort to conduct research and implement and evaluate interventions. Delays in the review process can feel like the IRB is pitting the institution's needs against the very urgently felt needs of the community. While these challenges are real and somewhat well documented, synergy is possible, and there are documented successes in institutions where CBPR is conducted. One such success involves cross-training among IRB personnel and CBPR partners. Institutions may provide an orientation to the concepts of human subjects protection and research ethics, as well as the logistical challenges presented by the volume and nature of requests and government oversight. Community and academic researchers may strive to educate IRB personnel about the principles of CBPR and how it also strives to eliminate the harms and maximize the benefits of research for all in the community, even beyond the individuals who may be participants in the research. These efforts to create shared understanding of the goals and objectives of both CBPR and research ethics reviews have helped the relationship in some institutions between ethics reviewers and research partnerships to start on the right foot. The addition of CBPR researchers and community research partners to review committees is another example of addressing the relationship challenges between CBPR researchers and IRBs. A second strategy that has seen some success is allowing for communications outside of the formal human subjects review platforms directly between IRB staff and CBPR partners, allowing them, for example, to email or even call each other. This can break down the barriers that exist if every communication must happen through the official IRB submission portal. Additionally, some institutions have gone so far as to give institutional email addresses to non-academic partners so they can have direct access to the IRB platform, allowing them to see firsthand and on their own time how the review process works and giving them direct access to it. A third set of strategies is related to flexibility and adaptability of the review process. In the US, individual IRBs have leeway to create the processes that support their mission. Thinking about ways to adapt those processes to better fit the needs of CBPR partnerships, especially in institutions where this kind of research is prevalent, can go quite a way. For example, some institutions have accommodated the iterative nature of CBPR and the participatory approach to research design. In CBPR, academic and community partners work together to co-design studies and interventions. This level of collaboration requires an intentional focus on relationship building and the quality of partnerships. The collection of baseline data about the partnership, and sometimes even subsequent waves of this data collection, often occur before the specifics of the community research elements are defined, those that will also ultimately need review. This iterative process will benefit from a phased approach to the IRB review process, where partners can submit early parts of the research process for review and then submit later components when they're ready. Other examples of institutional flexibility include adapting training, such as that provided by the Collaborative Institutional Training Initiative or CITI program, to be more appropriate for non-academic partners, or adapting consent language to be more appropriate to the level of risk involved in a CBPR study, and therefore more accessible to the diverse educational and literacy levels across community research partners and participants. These have been a few of the challenges experienced and articulated by CBPR researchers and members of research ethics committees and the IRBs, and some of the innovative solutions that have been created to address them. I hope that this presentation provides some useful background for the presentations that will follow and give some framing for the experiences that my colleagues on the panel will share. And I think if we have some time, we can open the floor to questions, and I'll stop sharing my screen.
Adam, that was really interesting, and I really resonated with a lot of the things that you said and some of the things that I see. So as someone, I probably don't talk about community, I don't use the terminology you use around community-based research, but it's all very similar. The idea being, lived experience partnership in research. And I thought a really interesting idea was this idea of academic control rather than shared control. I think there's a lot in that, and sometimes I feel that the ethics process is quite patriarchal in deciding, even risks, benefits, what people will do, and it doesn't necessarily have that lived experience context to know that in different situations people are prepared to do things that healthy people that aren't marginalised, all those things wouldn't do, perhaps. So I thought that was a really interesting idea. And I also love that example that you gave there of the staged approach. So having bits of the protocol, I don't know how that would be handled in the current system that we have in Australia of ethics reviews. But it's a really interesting idea to see whether or not you could have that staged approach, because I think that could lead to more interesting, relevant, meaningful, like properly co-designed things, rather than having to use that process of questions back and forth to iterate the project.
Yeah, the way that has worked in the institution where I am is they have sort of a shell submission. So you kind of give an outline to the review committee about all the things that will be coming, and submit for formal review the initial processes for collecting baseline data that will help you later evaluate the quality and the components of the partnership itself. So that part can be clarified early And then once the partnership is up and running and can start to really design the community facing work, then that part can be reviewed. But the IRB, in my experience, in my case, sort of sees it as one big project, and they just know that they're going to be reviewing, preliminary parts first, and that everyone understands that you don't do sort of community data collection until the rest of the components have been formally reviewed.
Yeah, no, interesting. I think it's interesting. The other idea, and I'm hoping that maybe through Seb or Beck's presentations, this idea of evaluating the partnership and that being research in itself. I think that's a big question mark in this space. What is research? And maybe this is another one of those non-research research questions.
Right.
And maybe, Seb and Beck might touch on some of this during their presentations. I'm not sure. I haven't heard them. But I did promise to keep to time. So if anyone has any questions, please pop them in the Q&A for Adam. Great presentation, really thought-provoking. Thank you. And